Well, I just want to start by thanking you all so much for being here. I am the coordinator of the Grandmothers to Grandmothers campaign with the Stephen Lewis Foundation. That's sort of my that's normally my day job. It's now my midnight job at this point. But the truth of the matter is, if anyone has met the Canadian grandmothers who are working in this community tirelessly for the African grandmothers, you would know that one could hardly claim to be a coordinator of these women. I'm lucky if I am a keep-up-inator with these women. But, and so it's fantastic to be on this caravan, not only to present to you these phenomenal women that I've had the opportunity of getting to know on the road, but also to be able to come into this community and meet the women who are working across Canada, coast to coast, and along with many other Canadians, young people, and other individuals who are working to bring sustained change alongside those on the grassroots, working in the grassroots communities in Africa. So just a little bit about where this caravan is coming from, where we're going, why we're here, and then I'll turn the floor over to the women that you're really waiting to hear from. The caravan is a reflection of some significant change that the foundation has been noting over the past year or so. When the foundation began in 2003, our aspirations were quite humble. It wasn't to fight HIV, it wasn't to find the cure, it wasn't to make any grand sweeping gestures. It was recognizing that this disease flourishes where there is social injustice, it flourishes where there is gender inequality, and that if you want to stand up and act out in the name of social justice, let's start where the world is hurting most, and let's keep it simple. Let's get resources and help to those who are most impacted, and also those who are doing the work. And so that when Stephen came back from being UN Special Envoy, he was speaking about the grandmothers of Africa, the women who, and I think this story is familiar, I keep finding that when we come into communities, they know this story. They know that it was the grandmothers who had to bury their children and begin reparenting grandchildren just at an age when in fact they were supposed to be enjoying their family and the fruit of their labor. And instead we're watching a country decimated where the workers were gone, the education system had no teachers, the hospital had no nurses, and they have their precious grandchildren and want to bring them up in a place and in a world that's safe. Grassroots organizations just started doing the work. And so when we began, we said, well, let's try to be a part of easing the pain of HIV and AIDS in Africa. Let's get a few dollars down to the ground so that the people who are doing the work can have a little bit of ease. Maybe they'll have gloves, the ones who are caring for the sick, so they're just a bit more protected. Maybe there can be one meal a day for children so that they can actually absorb the education they're getting while they're in school. But the story is one that is quite different than what we expected, and it's twofold. One is after 4 years of receiving sustained support that is coming from Canadian communities, when we returned to the projects, we found something had changed. We dramatically underestimated what these grassroots organizations would do with a little and how they would turn it into a lot. And the escalation of programming, networking, the expertise that's being applied to programs on the ground, the complexity of these holistic responses is doing a lot more than easing the pain. We realize we're doing a disservice to these projects to just say we're easing the pain, because these projects are actually on the cusp of turning the tide of HIV and AIDS in Africa. They actually are frustrating this virus, and the story in Africa is not one that we thought it was. This picture of hopelessness, of sorrow, of Africans as agents that can't do anything, that are just needing handouts to get through the day to day to day is not true. They're strong, powerful, resilient, creative women, and there are some men, but primarily women, who are stepping up and standing out and changing the continent. And it's exciting, and we thought, we need to share it. We need to share it, because there's a change that's going on. And when I talk to people about HIV/AIDS in Africa, the response is, it's so big, And it's the same story, and it's a black hole of despair, and it's so sad, and it is horrifying, and it is still full of sorrow and despair, but there is hope that is juxtaposed in there, and it's being brought to us by the women that you will hear from tonight. So on top of these African grandmothers who are doing this work, 25 years into the pandemic, when we talk about children orphaned by HIV and AIDS, we're talking about a lot of young adults and teens as well, which is, again, another parenting challenge to start with, another parenting challenge for grandmothers who've raised their children and now need to know they are not going to go the way of their parents. This is a totally different issue than raising a little child. And then these teens and these young people, they are also stepping up as leaders. They too know what they want, they know what they need, they know how to move forward, but they do need some sustained support to do it. So the Caravan invites both voices to step forward and share what's happening to you on the ground. That's why the granddaughter is coming along, and that's why it actually is a very historic moment, because this has been a voice that has not been heard on the international scale. So we started the Caravan in Newfoundland on September 7th. We have been driving across the country since then, all through the Atlantic provinces, through Quebec, all across Ontario. The first pair of African granddaughters came from South Africa and represented one of the projects that is funded by the Stephen Lewis Foundation. And in Toronto, we stopped and we changed teams, and we have welcomed onto the Caravan these women from Malawi, who also have their own stories and their own voices, and they will continue on. They're coming up through Barrie, we've been to North Bay, we've been to Sudbury, the Sioux, we're here tonight, we're off to Winnipeg tomorrow, and they'll continue as far as Sherbrooke, Saskatchewan, before another team comes from Swaziland. So it's been phenomenal, but as I said, it's a twofold response. We underestimated what was happening on the ground in sub-Saharan Africa, but we also underestimated what would be happening here in Canada. It started very much, we say, absolutely with the Canadian grandmothers. In 2006, they met 100 African grandmothers in Toronto. They made a pledge, we will not rest until you can rest, and they took it seriously. There's over 240 Canadian grandmother groups in this country. 5,000 to 10,000 of them are involved, and they're raising awareness, they're raising funds, they're fighting on Parliament Hill for sustained policy changes, and they're a force to be reckoned with, and they're also challenging this country's perception of the value of older women as their place as society changers and global agents for change. So we call them all elder stateswomen with a lot of respect, and the Caravan invites the larger community to step in and step alongside the Canadian grandmothers and learn from their example as well. So that is the Caravan. It brings a message of hope, and in this community tonight in North Bay, Thunder Bay, I just want to say that your presence in this room, being willing to listen, just gathering here and recognizing these women as the experts that they are, is already social justice in action, because you can't actually engage in true social justice if you're not willing to learn to listen first. And every one of you came and made that space, and that's powerful, and that's historic. So thank you for being here tonight.